Thank you, Dr. Archana, for your warm welcome note. Good evening, one and all. So, wonderful evening to everyone who have joined here for the session. So, myself, Dr. Susmitha, working as a consultant and physician in Apollo AyurVAID, Chennai. So, today we are going to have a session, especially which is a time indeed and an essential topic, importance of neurodevelopmental disorder, especially with what Ayurveda, what precision Ayurveda can do to address these conditions. So I will share the slide so that you parallelly can look into it during the session. So hope the slides are visible.
Yes.
Yes, doctor. Okay, thank you. So precision Ayurveda for better motor, sensory, and cognitive skills in pediatric developmental disorders. So for understanding more about neurodevelopmental disorders, we need to understand the basic functioning of brain. So we all know neurodevelopmental disorders means a child's brain and nervous system don't develop in the usual way. So before going into the abnormal way, what is the functioning of the brain? So which we can correlate with a broader term called cognition, which starts from a small thought. And from that thought begins the emotions and actions. So this thought is actually derived from a past learned experiences, which should be decoded from the memory. So for the memory to happen for a child, there should be new experiences that should be given through the developmental phases of a child. So understanding cognition is not a simple process. It is a complex metabolic process that is actually reflected as the communication and behavioral skills of the child. So this is a complex term which includes memory, understanding language, and acting appropriate to the language, communication, and the behaviors. So this is more about cognition. So with understanding of cognition, how learning occurs. In a child, basically, child is learning. We call it as child as a silent observer. What we do, the child observes in the family or the environment where the child resides. So to make a child learn a new skill, first we need to show the child the basic skill. And along with the parent or the teacher or whoever is guiding the child, we should do the skill together. And the third step is watching the child doing the same skill. And finally, child can do it independently. So this is how learning happens. And basically, child need to listen and understand and then learn. So it is a complex process which we, along with the child, we need to practice together to attain the proper learning and cognition for the proper development of brain. So how attention helps in learning? Definitely attention is the focus of one particular thing. When in neurodevelopmental conditions or like a child with a problem in development of brain, there happens cognitive bias because of the environmental factors or many other factors, there happens a cognitive bias because it covers basic mental processes like decision making, problem solving, and reasoning. And this attention is like focusing on one particular thing. So when the brain is not occupied or properly occupied with proper senses or proper impulses, there happens cognitive bias. From this starts the problem with the child. Like this starts with the problem in speaking or understanding the language, which further develop as behavioral issues or issues with writing, and also the communication problems, and also learning new things, because there happens an obstruction between learning and new impulses is obstructed from further progression of the learning process. So this is the basic thing about the developmental happening in the brain. So when there happens a problem in normal functioning of the brain, it reflected as major three conditions. That is, one is with intellectual problem, the other is with the behavioral issues, and finally the third one is basically with attention and or more of concentration issues. So these are the basic condition which like autism and attention ADHD, we are all familiar with it because more and more researches are happening in this field. And moving into the prevalence of neurodevelopmental disorder. So this is a data which is published in 2011. So in that Indian economy, when it is Indian population, when it is addressed, 1.1% of child is affected in between the age of 0 to 4. So could you please, anyone think about the prevalence in 2025 or 2024 after 10 years or after 12, 13 years? So 1 in 8 children is affected with neurodevelopmental conditions. So one good thing is parents or the teachers or the guardians are more knowledgeable and they are getting assessed at the earlier stage so that more cases are coming out. But at the same stage, there are alarming signs of increasing numbers in neurodevelopmental disorders nowadays. And moving on to the prevalence in South India, this doesn't mean like the frequency is more in South India. More the studies conducted, so the data is published. So the total learning disorders percentage is around 15.17%, which include dyslexia, dysgraphia, and dyscalculia. And what are the ways to diagnosis? So as a parent, like one of the most important question coming to our mind will be like, at what age my child can, like I can diagnose, I can understand the problem. There is a problem with my child. So definitely from the beginning itself, like from the 6 months or 9 months or 1 year itself, we can understand some red flags like the child is not giving a social smile or proper eye contact is not there. So definitely that is one of the earlier red flag. But moving with age, by the age of 2 or age of 3, we can properly diagnose with a specialist or by getting consulted with a specialist in this area. So because this is not cannot be understood with a biological check or like blood biomarkers need not to be essentially high in these conditions. So definitely there should be a proper clinical observation along with behavioral and cognitive, motor, and sensory assessments through international scales and tools that can be done along with parents and also the teachers' side also. So, so everybody will be knowing about the term autism and autism spectrum disorder because it's not a one single symptom or it's like it's like a collective symptoms affecting multiple areas. So it is known as autism spectrum disorder. And one of the early indicators of ASD is definitely, as I already mentioned, like the child will not be giving proper smile or proper eye contact. The child will be aloof or alone, will be sitting in one space without interacting with the public, or social communication will be very less. And there happens, in many cases, there happens complete lack of speech and communication, but many cases it happens as a regression also. Like when the child will be like talking or communicating in a better way, but in gradual, when the time passes, like maybe in the late 3rd or 4th year of age, there happens a regression in the attained motor and cognitive skills. And definitely it will be coupled with repetitive and stereotypic and maybe aggressive behaviors, which is not normal to the so-called community or social settings. And many of the autism symptoms, say autism spectrum symptoms, persist into adulthood. And it may be reflected as personality disorders in many of the cases, and if it is not addressed properly at the right time. And along with that, symptoms like communication skills can definitely improve over time. But with this, I would like to tell the importance of early diagnosis and early intervention as the basic thing to address neurodevelopmental conditions in a better way. So child does definitely want to enjoy or experience all the inputs or senses that is around the baby where he or she is growing, but the child is unable to perceive it or unable to process it. So he himself feels alone, and there happens a barrier between the perceptions and perception skills and also the child. So how to break that barrier? That is what we need to understand by understanding the pathophysiology or the chain of cycles that is happening in a neurodevelopmental kid. So definitely there is a genetic cause. There happens a mutation in certain genes that is running in the family, but definitely not all are affected with neurodevelopmental disorder. when there are environmental factors that happens during prenatal and preconceptional, even conceptional, and also during the delivery of the child, there happens a lot of stressors in the maternal health, along with the environmental factors, which may be some kind of exposure to toxins or nutritional deficiency or any other thing. So that can be a add-on to the genetic causes, which we have already mentioned, and that is paving way to a functional derangement of brain and affecting child in a early childhood itself. And along with the above mentioned three factors, metabolic factors definitely play an important role, and many researches are happening in this area to understand what is the relationship between digestion or gut dysregulation with the symptoms in autism or neurodevelopmental disorder. So definitely, as we already, like most of the people know, like increase intake of sugar or like high carb food or heavy digesting food like casein and gluten increases the behavioral problems in the child, and because these causes oxidative stress and also releases more toxins that finally leading to immune compromised state. And looking these conditions in an Ayurveda perspective, this is definitely bija dosha, or we call it as I've already mentioned it as genetic imbalances, along with the stressors, which is starting from the during throughout the pregnancy or even the conception happens. So here comes the importance of a planned pregnancy, which is explained in Ayurveda, like the importance of a planned pregnancy, which can be planned through proper cleansing program or a panchakarma program according to the body constitution of the mother and along with the father. Like both can undergo a proper pre-planning during like if they are planning for a conception, that includes dietary changes, lifestyle changes, and also some cleansing programs that is conducive, that is good for both mother and father. And with that we can avoid all these conditions to an extent. And along with that, even improper feeding practices, because introduction of early packaged foods or tinned foods along with breast milk, like many supplements or many milk products are there which have processed processed foods are there which have a lot of toxins, or like in from the childhood itself, if the child is exposed to various toxins, definitely this will result in gut dysregulation, which will be explained in the later slides in detail. And along with that, improper parenting is one of the cause. So when I write this point, I'm thinking like, is there any proper or improper parenting? No. See, this is like a term which I've put because we need to make it as proper. So as a parent, we need to understand as like there are certain things we need to accept first, because in when I addressed kids with neurodevelopmental disorders, like in the beginning, when we tell like the child is having a tendency to get uh, any issues like attention problem, hyperactivity problem, uh, they never accept, or like there is an acceptance issues in the beginning. So but when we address or when we understand in detail or like in further consultations, they themselves accepted, okay, I can change some parenting practices which might be one of the reason. Okay, for example, like introduction of same pattern of food like for the kid in the early stages, like if the food if the child is not open to various kinds of tastes which is present in various cuisines or various food items, if the child is sticking to one kind of food item, definitely in turn like the child will be turned into a picky eater. So many things are there. So identifying the root cause and accepting the situation is one of the important thing. And along with that, definitely the other causes which we can explain through Ayurveda terms, like impaired digestion, because the digestion is considered to be as the root cause for many diseases. So impaired digestion or Agni Mandya, or the problem in the digestive fire that is leading to accumulation of undigested materials, what we call it as ama, and that is reflected as ama visha or toxic metabolites, that will definitely lead to systemic endotoxemia, or we call it as a leaky gut problem. And this happens, and this will lead to srodhoroda or blockages in the channel, and finally causing problem in the development of brain. And some of the precipitating factors, as everybody will be knowing, like increased screen time, because these kids will have more affinity to watching visual, more expression towards visual impulses, or like will be addicted to visual images, because it is very easy to connect, but at the same time they are difficult, they don't know how to process it. So repetitive watching of the same videos or same patterns of videos will be watched by the kid, because they don't know how to process it and move to the next stimulus. So this is seen in many child, and even the neglected childhood bullying and childhood trauma also find as some of the precipitating factors for developing neurodevelopmental disorder. And moving on to the Ayurveda perspective, as we all know, in Ayurveda, every condition is understood in a comprehensive way, in a holistic manner, along with body and mind. We address each and every condition by understanding thoroughly through a proper assessment, with the understanding of gut or digestive fire and metabolism. So in that, neurodevelopmental condition is also the very same, where we understand as a neurological issue, where we have the problem in the body, at the same time there is problem in the mind also. So the imbalance of the three doshas, that we call it as vata, pitta and kapha, happens. Along with that, manasika doshas also get vitiated, we call it as rajas and tamas. So these are the factors that should be balanced and should be taken to the normal balanced state for reducing the symptoms of the baby. And for understanding that, we need to definitely understand the gut-brain connection. So as we already discussed, there is a strong relationship between gut and brain, and it is considered to be the direct pathway or connection between brain. So if digestion, or if there happens proper metabolism, so definitely the child, many of the childs will not see, many of the child that already having genetic factors or any environmental issues are already there. But if the kid is having proper digestive system, or a proper metabolism, the symptoms can be addressed in a better way. So because poor digestion can lead to metabolic overload, along with the cognitive overload, which we have already discussed, and which can impair brain development and cause hyperactivity. So the first and important step is to start with the gut. And definitely many of the kids with neurodevelopmental disorder will have associated digestive issues like constipation, irregular bowel movements, gas, bloating, etc. So that definitely have a impact over focus, over the mood and learning, because these causes gut inflammation and allow toxins to enter into the systemic circulations, and resulting in the gut, resulting in the brain issues or behavioral issues like irritability, temper tantrums, and sleep problems, etc. So finally, this reflects as a chronic inflammation, along with gut dysregulation and immune system dysregulation. And this is actually one of the common things which is explained as a contributing factor for autism and ADHD nowadays, because almost all the researchers are focusing on the improving the gut microbiome in a immune compromised, or in a gut dysregulated ADHD or autistic kid. So correcting the gut-brain dysregulation definitely will improve the gut microbiome, and finally reduces the inflammation that has happened in the gut, and the systemic circulation will also finally improve, which we can explain it as dhatu-gata ama, or like improving the tissue level maturation. So there happens improper maturation at the tissue level. So when we address the gut dysregulation, parallelly the metabolism and system level improvement is happening for the child, and definitely that will reflect in the positive development of brain factors. And this is one of the area which we correlate it with dhatu-gata ama, or like a problem in Dhatvakni level, or deeper tissue level problem is there in these neurodevelopmental children, which we call it as by a term called Dhatvakni Mandya, or this is better explained by many studies with a term called leaky gut syndrome. And because when the child is taking heavy digesting things like dairy products or gluten or even sugar, high carbohydrate containing food items are intaken, like the body itself cannot eliminate it, and it will reflect as a inflammation in the gut, and thereby it is being permeable to it becomes more permeable to the systemic circulation, and reflected as a systemic endotoxemia, and finally reflected as an immune compromised baby. So what is Ayurveda approach? How we address a kid with a neurodevelopmental disorder in our centers. So basically, we undergo a detailed assessment that starts from 45 minutes to 1 hour, where we understand the basic composition, basic health composition of the child, that covers all the parameters, starting from functional parameters and moving on to the other assessments of Ayurveda assessments, along with detailed history taking. So this is one of the core area where we understand about the body constitution, prakriti and vikriti, or vitiated factors in the child. And from this data, we definitely will get a more understanding about the gut microbiome and the pattern of gut, and also the understanding about inflammation, intestinal mucosal inflammation, and whether there is a leaky gut or whether it is deep rooted tissue level damages has happened, and definitely understanding more about the whole body. So this happens in the initial assessment, and there happens healing through digestion, because as we already discussed, addressing the gut dysregulation is the first and foremost step in addressing all the neurodevelopmental cases, and finally addressing the immune compromised state of the child. And these are some of the publications that shows the direct relationship between leaky gut and importance of biomarkers for early intervention in autistic spectrum disorder, and with special reference to gut microbiome. And moving on to the pathophysiology, as we already discussed, there is a genetic factor is there, and along with the impaired digestive strength, there happens increased permeability to certain food substances, which is there in casein and gluten things, which reflect as an undigested material, and it partially or undigested or partially undigested material in stomach, and it mimics as an opioid hormone, like it's like the makes the child as in a sedative or stressed state, which reflect as a kind of intoxication, and that crosses the blood-brain barrier, resulting in functional impairment. So definitely this will have a defective neurotransmitter functioning also, like dopamine and serotonins, and also because almost all the kids will have ups and downs in the moods. So this is one of the pathophysiology that is happening in the autism and ADHD or neurodevelopmental kids. And what are the concerns in Ayurveda management? Definitely, we address the first and foremost thing, as we already discussed, we address the impaired metabolism, and then moving on to the next stage, that is addressing the systemic absorption or tissue level, addressing the tissue level issues, where we address the functional and structural maturation of dhadus. We already mentioned about the vitiated doshas, which is like Vata and Pitta, along with all the doshas. Vata and Pitta is the predominant doshas which is affected in these kids. So along with digestive correction, we parallelly address the vitiated doshas and addressing the mind and the functionality of the mind. Along with that, we incorporate certain counseling techniques or Sattvaje Chikitsa, we call it as psychotherapy, which is given through proper understanding of the baby's behavior and the vitiated doshas of the mind. So moving on to the nutritional challenges, definitely these all should be taken care during the consultations, and we will be taken care, will be providing a proper lifestyle and diet, because almost all the kids have digestive problems and food allergies, intolerances. They'll be choosy and picky eaters, so repetitive diets will be there. So incorporation or micro dosing of new diets and cuisines is very important to improve their gut microbiome. So we go through all the diet which is not suiting for the kid, then we micro introduce each and like, because many of them is good for the child, for the proper development, it is very good. So After understanding or after correcting the metabolism, we go through every diet, and we prescribe a proper diet plan. According to it, we carry forward the treatment. So making the parent understand about the treatment timeline from assessment to recovery is a big process. So once the parent is aligned with our system and they understand it will take time and this is the process, they have all the acceptance and they will patiently wait for the positive outcomes to come. And we offer safe, gentle treatments, which is specifically designed for the children in all the cases that is coming to our OPD. And these are the basic protocol we follow, which we have already discussed in the previous slides. So managing child's sensory issues with many treatments, like starting from many treatments which we give over skin. Like skin is considered to be the largest organ, so we choose skin as a pathway to address the mind. So skin being the largest organ, when we address all the therapies or massage or all the powder massage, oil massage, everything we start with the skin. So because skin is considered to be the easiest way to address the mind and mind related problems. So definitely these therapies will have a calming nature that reduces the hyperactivity aggression of the kid, and a structured daily routine that includes gentle exercise, yoga, and also building a proper exposure along with the discussion with the parent. It's like improvement in the senses, so that because these kids will be hypersensitivity or sensory seeking experience will be there. So in introducing more and more sensory inputs will definitely have a positive impact over their development. And these are some of the studies which is conducted with Ayurveda treatments that has shown very good result in autism and neurodevelopmental disorders. And this is one of the case studies which we have treated in Apollo AyurVAID. And these are the key improvements noted. A case of ADHD and a diagnosed 11-year-old male child, ADHD and autism spectrum disorder. Before and after is being explained here. And so this is from a teacher. So it's like a heartwarming note which is shared by the teacher. So this is the another study, which is a spastic CP with ADHD, 5-year-old female child. These are the outcomes which we observed. And definitely after the treatment, her behavior and even the eye contact and the social smile, functional parameters have been markedly improved. In both the cases, parents and the caregivers are very happy with that. So moving on to the diet. So diet is also very important in throughout the treatment process, and even till a point comes where the child is independent enough to understand the senses or sensory inputs. We need to follow easy digestible diet plan that includes that differentiates that will be differing according to each child. It will not be the same for everyone, but usually it is advisable to follow easy digestible vegetable or more of easy digestible food items, maybe steamed, and that can include certain things which is aiding digestion, maybe buttermilk or processed with curry leaves, ginger, pepper, etc. That actually should be taken into consideration after a proper consultation with a doctor. And mostly followed diet is gluten-free, casein-free diet, and these are the basic things which all around the world it is following. And to be avoided, as we already discussed, the importance of proper digestion and its relationship between brain development. So these are some of the diets that should be avoided. And in a nutshell, so there are 4 things that we always should keep in mind. So in Ayurveda, we improve digestion and overall metabolism, thereby improving the proper operation of all the channels, and gastrointestinal tract or gut to be considered as the main one. So an outcome of that, there happens detoxifications, and finally proper nutrition will be facilitated to all the tissue level along with the proper functioning of the brain. and thereby the outcome of that is definitely the vitality or overall nutrition of the child is improved. And there happens proper maturation or rejuvenation of the dadus happens, and finally the child will be more active or will be calmer and will behave in a better way when compared with the previous assessment things. And definitely it should be coupled with administration of Medhya Rasayana or intellectual promoting drugs which have action at nutrigenomic level, like that can be included as many forms. Basically, we give as medicated ghee and also a sensible Ayurvedic diet with a yogic support or mild general exercises according to the need of the child. So this is the session in nutshell. And so here I would like to focus one more point. So we consider parents or the guardians as the frontline barriers because we can only treat. So whatever the things we give or advices, what we suggest should be followed or should be taken care by the parents. So they might be with many other busy schedules or whatever they might be working. Along with that, they need to take care of many things. So first of all, taking their mental health is also very important, and you must find time by taking care of yourself first, and you are considered as the frontline warriors. And parents role is very important throughout the therapy, throughout the treatment, throughout the growth of the child, till the child is able to independently take care of these things. So these are the major concerns and related queries which I always or which we always get in the OPD. So what are the expected outcomes through Ayurveda in what duration? So definitely the expected outcomes is improvement in the functional parameters, appetite, digestion, sleep, and bowel movements will be definitely improved, and the proper intake will be there so that the energy level of the child will be improved, and the outcome parameters that includes the aggression or the behavioral changes, even the communication level changes is being noticed after a certain amount of time. So the duration, it definitely depends on the severity of the condition, mostly after 3 to 6 months. So we cannot tell like each child is different, each condition is different. Definitely 3 to 6 months, good outcomes will be expected. And what is my role as a parent? And can I get trained as for home therapies? Definitely. So because you are the frontline warrior, so you need to take care of the child, and we will train because the diet plans and the therapies, home therapies, what we advise should be given through the parent only. So you as a frontline warrior should take the step forward to address and to incorporate all the interventions in proper way. And what kind of diet is recommended, which we already discussed, and how good lifestyle practices positively affects in child growth. Definitely, good lifestyle practices has a positive effect in child growth because, as I've already mentioned, child is a silent observer. Because in neurodevelopmental children, we tell like when we go to a forest, they see only the tree, they cannot see the forest. So basic interpretation or the outcomes should be coming through the parent only. So as a parent, as a guardian, you should incorporate positive lifestyle practices. They will observe and they will follow you. And is there any Ayurveda specific lifestyle? And there are many Ayurveda specific lifestyle according to the child. We call it as Ayurveda regimen that differs according to each child. And milder, safer, gentle Panchakarma therapies can be done in children. And the final, almost everybody will ask this question during the consultation: are Ayurveda medicine safe? And we in Apollo AyurVAID prescribe only the safest medicines for the children, and no further or side effects are seen till now. So thank you all. Thank you all for the patient hearing. This is what we have included in the session. And if any doubts or any other concerns to be addressed or to be explained, to be discussed, you can explain. You can mention in the chat box.
Thank you so much, Dr. Susmitha, for that insightful presentation. I'm sure it gave all of us a lot to reflect on, especially for parents and clinicians working with children who need sensitive and comprehensive care. We'll now move on to the Q&A session. If any of the participants have any questions to ask, please feel free to type it in the chat box.
Good evening, Dr. Susmitha. The chat box is disabled, so I wanted to ask one of the queries. Am I audible? Hello?
Yes, doctor, you're audible.
Yeah. So it was disabled. That's the reason I just called. So you spoke about the gut microbiome differentiations. So what type of gut bacteria are influencing for this developmental disorders, and what are the changes do you see in this gut microbiome? Is it the transformation of the bacteria, or is it the quantum increases, or it become activated? Can you just throw some light on that, please? Thank you.
Sure. So thank you for the question. So definitely there happens. So gut microbiome is definitely it depends on the child. Okay, when we understand there is a gut issue, gut dysregulation happens. There are two levels. So first, it is only to the gut, and second level is it is to the systemic circulation. So it can be explained and it can be understood through the deep tissue level maturation. So if the child is obese, or like child is portion like a nutritionally built child, so we need to understand if along incorporated with gut issues, it should be the starting with the correction at the digestive metabolism in the stomach itself. And if it is a kuposhnageni or like a lean child, definitely the thing have gone to the systemic circulation or deeper tissue level damage has happened. So we need to address in a deeper level. So the outcome of both is reflected in the symptoms of the child. So more than understanding about the gut parameters, it is reflected in the symptoms of the child, because after correcting or after giving proper digestion or improving the metabolism of the child, if the symptoms become better or calmer, so we can understand a gut microbiome, or like there happens a good microbiome, reducing the inflammation and finally improving the symptoms. So this is what two lines of therapy we need to adopt according to the physique of the child, understanding the physique of the child.
If the participants have any kind of queries, you can raise your hands and we can unmute them and they can ask doctor directly. Doctor, there are a few queries in the chat box. One is, what should one do to support a child's motor skills at home?
A child?
What should one do to improve a child's motor skills at home?
Motor skills at home.
Yes.
Okay. So before telling like what are the things, it is basically to understand what are the symptoms and what are the issues basically the child is having. So getting more understanding about the child condition is first necessary, and there after that, after understanding that, we can definitely plan a lifestyle improving practices that includes daily regimens, that may start with some setting up some task or some long-term task, which with a duration of 1 month or 45 days, and that includes some regular practices, which may be like including, as I already mentioned, some yogic exercises, that asanas that can be practiced, or even daily application of oil, which after consulting with the doctor. So these certain practices we can adopt, but it is basically advisable only after a proper consultation with the doctor.
Miss Nilina, you have a question. You can unmute yourself.
Yes, ma'am. ഞാൻ മലയാളത്തിൽ സംസാരിച്ചോട്ടെ?
Yes,
പറയൂ.
ഹലോ. എൻ്റെ പേര് നിലീന. ഞാൻ തൃശ്ശൂരിൽ നിന്നാണ് വിളിക്കുന്നത്. സംസാരിക്കുന്നത് പ്രധാനമായിട്ട് എന്താണെന്ന് വെച്ച് കഴിഞ്ഞാല് ഇപ്പം കുട്ടികൾക്ക് കൊടുക്കുന്ന പല ആയുർവേദിക് മരുന്നിലും മെറ്റൽ കണ്ടന്റ് അടങ്ങിയിട്ടുണ്ടെന്ന് പറയുന്നു. അതായത് ഞാൻ മോന് മാനസമിത്ര വടകം കുറച്ചു കാലം കൊടുത്തായിരുന്നു. അപ്പൊ അതവന് പിന്നീട് തലവേദന എന്ന് പറഞ്ഞുകൊണ്ട് സ്റ്റോപ്പ് ചെയ്തു. അപ്പൊ ഇത് പിന്നീട് ഒരു പ്രോബ്ലം ഉണ്ടാക്കുമോ? അതും ഇപ്പോ അപ്പോളോ ആയുർവേദിന്റെ അതില് അതും കൂടെ അടങ്ങുന്നുണ്ടോ? അതായത് ഇത്തരം മെഡിസിൻസില് മെറ്റൽ കണ്ടന്റും കൂടെ ഉള്ള മെഡിസിൻസ് അപ്ലൈ ചെയ്യുമോ? അതാണ് അറിയേണ്ടത്.
സോ ഞാൻ ക്വസ്റ്റ്യൻസ് ഡിസ്കസ് ചെയ്ത സമയത്ത് പറഞ്ഞിരുന്നു, എല്ലാവരുടെയും ഒരു കൺസേൺ തന്നെയാണ് ലൈക്ക് ആയുർവേദ മരുന്നുകൾ കുട്ടികൾക്ക് കൊടുക്കുന്നത് സേഫ് ആണോ എന്നത്. സോ ഇപ്പൊ നിങ്ങൾ പറഞ്ഞ ഉദാഹരണത്തിൽ പറഞ്ഞിട്ടുള്ള മരുന്ന് നമ്മൾ ഒരിക്കലും ഒരുപാട് സമയത്തേക്ക് ഉപയോഗിക്കുന്ന ഒരു മരുന്നല്ല. വളരെ കുറച്ച് ഡ്യൂറേഷന് കുറച്ച് സമയത്തേക്ക് മാത്രം ചില സിംറ്റംസ് വരുമ്പോൾ മാത്രം ഉപയോഗിക്കുന്ന ഒരു മരുന്നാണ്. ബാക്കി എല്ലാ മരുന്നുകളും ഇപ്പൊ ഈ പറഞ്ഞ സ്പെസിഫിക് ആയിട്ടുള്ള മരുന്ന് മാത്രം ഞാൻ എടുത്ത് പറയാണ്. അതല്ലാതെ എല്ലാ മരുന്നുകളും നമ്മൾ കുട്ടികൾക്ക് കൊടുക്കത്തക്ക രീതിയിലുള്ള ഡോസിനും അതിന്റെ ശുദ്ധീകരിച്ചിട്ടുള്ള മാത്രയിലും അല്ലെങ്കിൽ അതിന്റെ സേഫ് ആയിട്ടുള്ള ഡോസിൽ മാത്രമേ നമ്മൾ കൊടുക്കാറുള്ളൂ. എല്ലാ ആയുർവേദ മരുന്നുകളും നമ്മൾ ഇവിടെ പ്രിസ്ക്രൈബ് ചെയ്യുന്നത്, ഇപ്പോൾ ആയുർവേദത്തിൽ പ്രിസ്ക്രൈബ് ചെയ്യുന്നത് സേഫ് ആയിട്ടുള്ള മരുന്നുകളാണ്.
Thank you, ma'am.
Doctor, if you could just repeat the same in English for the benefit of other participants.
Sure. So the same question which Nilina has raised is like, are Ayurveda medicines safe for children? So there are certain medicines which has mineral content in that, but here we don't use any medicines which have mineral content in that, and especially for the children we are very specific and we only use the prescribed dose which are safer, and also if any emergency happens we prescribe certain medicines which should be given only for a certain prescribed time, like maybe 3 weeks or 14 days, not more than that, and after that we should stop it.
Doctor, there is one more question in the chat box. A child with obesity and hyperactivity, reduced attention, is unable to process alphabets. What will be the line of treatment?
So these two conditions are different conditions. Definitely, if the child is having any kind of learning disability, should be assessed properly through a specialist, and parallelly, if the child is having obesity also, like it should be addressed with a proper consultation only. Like we cannot tell with the minimum symptoms what right now is mentioned.
If any other participant has any other query, please raise your hands.
Hello, Dr. Susmitha, this is Dr. Ajit here. See, there was a question about that safety about the minerals and metals. I think I can help you in explaining a little more if you don't mind.
Sure. Please continue.
Okay. See, for the assurance of the people, the audience, let me identify myself. I am a team member of Apollo AyurVAID, who was heading the India's first drug testing laboratory in private sector for non-allopathic drugs. We designed most of the monographs now Government of India is using on safety norms. So that's the authority I'm talking on. So please be assured I'm talking based on my experience. See, the drug what she mentioned was Manasamitra Vadakam, right? So there are drugs in Ayurveda which contains traces of metallic elements. But number one, the parameter is bioavailability. How much you add is different. How much the body can absorb it is different. And what form it absorbs is one of the deciding factor. So Actually, Manasamitra Pradam contains traces of a gold salt. I say it's a gold salt, not metallic gold, actually. See, for example, in human blood, it contains ferrous salt, whereas ferrous salt is a part of the human body, whereas ferric salt is toxic. Both are iron, actually. There are two types of iron material. Like that, by the process, actually, this is coming as a ore salt, not auric salt, which is actually bioavailable and in traces, which will work on the cell in as a catalyst, which will be excreted out from the body in a normal process without imparting a toxicity. And the level of the bioavailable material that get absorbed into the system is actually far, far, far lower than the toxic level for an oral salt. Number one. Number two, there are studies happened in US about Saraswata Arishtam with gold. And actually, they were actually shocked. The study report very clearly says they were surprised to see that the modern medicine, which is breaking their head for the nanomedicine level, has been shocked for the oral salt present in traces in Saraswata Arishtam was actually in nano diskettes form less than 50 mu. That is much, much, much less than micron. And it was present in the form of nano diskettes, which has got actually an absolute safer limit and absolute bio-friendly line, actually. So, and for your information, the normal haridagi, the kadka, what we call in Malayalam, the shell has got biochelated copper in it. So normal metallic copper is different, biochelated copper is different. It is something like what we call hemoglobin and a normal iron. That is the difference. Amlagi, which is Nellika, that contains biochelated iron, actually. So the word biochelated means it is bio-friendly, friendly to the body, which can act, absorb and assimilate into the body where it is required, or body can take a call whether to absorb it or not absorb it. If there is a deficit, it will absorb it, otherwise body will not absorb it and metabolize it. That's all, actually. So checking a truphala and finding a traces of biochelated iron or biochelated of copper, actually that is bio-friendly one, which is naturally present in the herb. Like you eat a carrot, like you take a vegetable, any other vegetable, how it is the nutrition, as a part of the nutrition, the trace elements are available. Similar way only the herbs contains that is biochelated item, which is body friendly, which is safer compared to a synthesized one or a added metal material. And most of the these things, the bioavailable level is far within the safest limit for your understanding. And like Dr. Susmitha said, it is actually, there is a definite timeline for this. How many days safely we can give, that it will be far, far below the LD50 level, which is, we call it as a safety norm, number one. And one more thing I will tell you as one example. There is a mercurial preparation in Siddha medicine called Rasagandhi med. We have given it to outside government laboratories. They were not able to analyze it, and they were not able to trace out the added mercury in it. So the mercurial procedure was a problem. Then we told them, yes, we have added mercury. 600 ppm is available. 10 micron, 10 ppm is only the permitted limit. So what do you call? They tested and gave us this thing saying that, yeah, it is 600 ppm. Again, we rechecked it, asked, what is the method you used? They said, we used an atomic absorption mechanism. So atomic absorption mechanism usually works in 3000 degrees centigrade at a very higher pressure level. And actually human body at any situation, 3000 degrees centigrade is impossible. So that situation where the mercurous salt separates is practically not going to happen. So we simulated a mechanism for testing it at Venkateswara Visvesvaraya Institute of technology in Bangalore called plasma absorption technology, mimicking the human gut simulation. And we found that it is 610 ppb, 10 parts per billion. I mean, 1 by 1000 or 1 by 100th of the permitted limit is only available to the body, whatever the dose you give. So what bioavailability and what format the thing goes in, whether it is a salt bioexcretable, is the pivotal point before you get panic that, oh, it contains metallic content. It is a salt. So sodium is a metal, actually. We are taking common salt, which is sodium chloride, which is a salt. So the safety norm is decided not only just on what is added into it, but what kind of format it is added into this, and whether it is bioexcretable, biosynthesized, bioprocessable, and excretable, when if it is not necessary by the body, instead of getting it deposited into the tissues, that is actually more important. So whether you use the mimic when somebody is testing it, whether they mimic the human condition about the bioavailability is a crucial point thing. So in addition to what she said, these are some inputs what I can give you on the safety norms of Ayurveda drugs. Hello, am I audible?
Yes, doctor. Yes, doctor.
Yeah, that's all. That's all. I have concluded my.
Thank you, doctor. Any of the other participants have any questions?
Doctor. Thank you.
I think that's all we have today, doctor. Thank you once again, Dr. Susmitha, for patiently answering all the questions, and to everybody who joined us today.